So we are here with Katie, and it's a very interesting story of what happened to you. How old were you when you had the accident?
I was 15 and I was playing lacrosse and I was the goalie, and I didn't have, for whatever reason, there was like padding for every part of your body, but they didn't have anything for your neck. So I was playing in the goal, and I, from a very short distance, got hit really hard on the right side with a ball, and so my head snapped to the left like that. And I went to the hospital and they didn't take x-rays or anything, which is...
How far was your head?
Oh, well,
way?
then after, like after...
Oh yeah, go ahead.
Yeah, so nothing was done about it, and then for about 2 weeks my head was all the way over to the right on my shoulder.
As far as like it was touching your shoulder?
Yeah, it was like resting on my shoulder.
For how long?
About 2 weeks.
So for 2 weeks your head's over this way. Was there a lot of pain involved?
Yeah.
And so what were you doing at that point? For treatment?
I went to physical therapy because that's what they wanted me to do.
And they were trying to pull the head back?
They didn't, they just like were doing strengthening things pretty much. And all sorts of like stretching, which you've told me is the worst thing.
What, right, because she's a weak girl that's playing lacrosse and has got weak muscles. So here she is, this lacrosse goalie with weak muscles in her neck. That clearly had an injury that shoved her neck one way and pushed her head the other way. So for 2 weeks she's left basically with her head off her neck, right? And a lot of pain and trying to recover that. So tell us what happened like 2 months, 6 months, a year after.
I started having really intense sharp pain in like on the left side of my back, which is the opposite side, and my shoulder was raised a lot higher, and
so you started doing like
yeah, so I was uneven, and it was to the point where I couldn't really take a deep breath in because I still sort of have trouble with that, but just because it created a really sharp pain. And
you lived like that for
6 years.
For 6 years.
Yeah.
I had told you, I thought you came very close to having a real significant injury called spasmodic torticollis. And spasmodic torticollis is when you have, it's a deep brain injury from trauma, that your head gets shifted over so far and the patient can bring it back, but then it starts to pull back. And the interesting thing about your case is I thought you were very close to that, because to have your head stuck over like this, it's not just a pinched nerve. People with pinched nerves can, for the most part, keep their heads straight, but they're just in a lot of pain. When you get hit that hard and your brain tries to, when you think about what happened with her, the ball comes flying in, and I don't know if everyone's aware of lacrosse balls are really hard. So when that ball is flying at you, shoved her neck this way, the brain always, the body wanted to get away from the pain, so it shifted the head really far that way. And I think it causes a pull on the brain and potentially a brain injury. But tell us what you feel like on the table when I click the instrument and I adjust your atlas. Tell me what goes on in your body.
So when I get adjusted from this side, my head, like, it feels like it's spiraling this way, and it also goes back a lot. And it feels, I mean, I don't want to say lightheaded, like literally lightheaded, like my head feels...
But lightheaded is a good sensation, not dizzy.
Not dizzy, yeah.
No, lighter, and it feels like the head is moving.
Yeah, it goes back.
And what else does it feel like? Does it feel warm in your neck?
Yeah, oh yeah.
Can we get on that process?
I forgot about that.
Yeah.
Well, especially the first time that I got adjusted.
Let's go into that whole process.
Okay, yeah, so the first time I got adjusted, my neck felt really warm as soon as I'd been adjusted, and it was because of the blood flow that had not been flowing for the 6 years that I'd been injured.
Right. So the process of that ball coming in and shifting her head from her neck, caused a reaction in the arteries of her neck and her brain to constrict. So when we made the first adjustment, taking pressure off her nervous system is allowing her arteries to open up, and you can feel that when you get adjusted.
Yeah, and it makes my hands warm too.
And it makes her hands warm. We started to adjust the Atlas, and tell us how much it has changed the ability for you to feel like it's straighter, less pain in the neck, and function on a daily basis.
It's changed it a lot, and relatively quickly in comparison to how long I'd been doing other things like physical therapy and massage and acupuncture and all that. But yeah, it's been a huge change.
And the breathing is getting better. You know, it just shows you how much of an effect this adjustment and this injury had on your entire body. You know, and your hands weren't bothering you so much, right?
No.
No. But here you are that you adjust Katie's Atlas and her hands feel warm. So clearly something is disturbing the blood flow to your hands. So from the neck injury, not only did it affect her neck, it affected other places in your body.